When I walk out of a room after I see a new patient, I feel really good. I feel like, wow, I'm really helping this person through a very dark, sad moment, and I've given them options and I've given them hope. And that is the reason you get up and go to work every day. Cancer is an epidemic. It's the #1 cause of death in dogs. It's estimated that 50% of dogs over the age of 10 will get cancer. I mean, that's 1 in 2. It's crazy. The thing for me is changing the way people think about cancer, because people think it's depressing. People think that you're poisoning pets and they're getting very sick. And what I'm trying to tell people is that cancer is a treatable disease. The myths and misconceptions is that cancer is a death sentence, that there's no options. But there are a whole range of options and our owners don't know about that. My goal is for my talks to be extremely practical for the general practitioner. I want the veterinarian to be able to go back to their practice and have tools that they can use tomorrow that are useful, that are practical. This is what I keep in the top drawer in my treatment area for oncology. So what do you need to do an aspirate? The other huge myth is that pets won't tolerate treatment well, specifically chemotherapy. And what most people don't know is that 80% of dogs and cats have no side effects from chemotherapy. And this is one of my patients, Bella. And Bella's dad said she's an agility dog, but she's not going to be able to do agility. I said, well, let's see how she does on chemo. She was chomping the bit at the house, making him crazy, too much energy. And this is her in the middle of her chemotherapy protocol. She didn't win this day, but she was feeling so good that she could do her competition. One of the topics that I love to talk about is breaking bad news. And obviously that can be with breaking cancer news, but it could be with lots of bad things in veterinary medicine. It's not what you tell them, it's how you tell them the news that is going to sort of make or break the experience for them. And it's a complex task, but we're gonna break it down and I'm gonna give you just a couple of good key phrases that are gonna help you get through these conversations. I missed a very large tumor in one of my favorite patients, and Smokey's story became the inspiration for See Something, Do Something, Why Wait, Aspirate, which is my cancer awareness program. The guidelines for the program are simple and easy. If the mass is the size of a pea and been there a month, you want to do something, you want to aspirate it. I really think we're going to change the way that we find these lumps and bumps in early detection for dogs and cats. I want learning about cancer to be fun. I don't think cancer itself is fun, but that does not mean that learning about cancer has to be depressing, boring, and not fun. So I want the talks to be memorable, high energy. I want people to leave with a little bit of hope and optimism. I get so much personal joy from changing the way we think about cancer, changing the way we talk to owners about cancer, and the idea that we can find it earlier when it's more treatable. It's what gets me going.